Hi, my name is John Burdett, Life Sciences and Healthcare Industry Principal for SAP Hybris. Today I'll be reviewing a life sciences case study with you regarding a medical device manufacturer that operated globally and was experiencing pressure as a result of regulatory and reimbursement changes in its market. That was putting pressure on their profitability, and that drove them to seek a commerce solution that would help them regain some of that profitability. Specifically, this presentation will comprise a few parts. First, we'll talk about what the customers and patients in this market went through in terms of their journey. Next, we'll talk about what this customer's goals were in its digital transformation, followed by what their existing legacy system was like and what internal change management challenges they faced. Next, we'll talk about what the improved SAP solution was and what the results were. Let's get started. This slide shows how the medical device manufacturer sold its products, helped patients, and made money. On the left-hand side, you can see a patient consulting with their physician who recommends a specific kind of medical device, let's say something for COPD. That patient then goes to their hospital, or similarly, maybe they go to a home care provider. They're fitted with a medical device that helps them with their therapy for COPD. That patient's insurance company, or if they're on Medicare in the U.S., the government, then reimburses the hospital for that therapy in a specific amount. But the dynamic in this marketplace with the advent of the Affordable Care Act in the U.S. changed because many medical devices were receiving regulatory pressure to have their reimbursement rates decreased. What that means is that the government and private insurance companies were paying hospitals or medical distributors less money for the same medical devices versus what they had previously done. This was putting a tremendous amount of pressure on hospitals to be more efficient. This was putting a lot of pressure on medical device distributors who were receiving less money per unit for the same devices they'd always sold. And that was putting a lot of pressure on medical device manufacturers who were accustomed to making certain levels of profitability and now were facing pressures for the first time. Specifically, this was putting a lot of pressure on the global medical device manufacturer in this case study. On one side, the government was lowering reimbursement rates, which meant less money in the market for certain medical devices. On the other side, providers like hospitals and home care providers who were receiving less money from those reimbursements from the government, from private insurance companies, and were putting pressure on the global medical device manufacturer to lower their prices so that those providers could regain some of their profitability. So let's talk about what led the global medical device manufacturer in this case study to SAP Hybris and what their goals were for their overall business in light of these pressures. First, the medical device manufacturer wanted to do a better job of prioritizing its accounts. Due to the reimbursement pressures, all of their customers wanted a price reduction for the same units that they'd purchased in the past. But not all customers were created equal. How were they to prioritize? Next, they wanted to sell more efficiently across 10,000 call points in the U.S., 80% of whom were small accounts. Among those small accounts, they wanted to drive awareness and growth because there were many customers, as I mentioned before, over 10,000, and they wanted to control margins but drive awareness and grow sales among those small customers. And next, they wanted to drive integration. Their existing legacy solution did not fully integrate with their ERP system and was sometimes out of date. So let's talk about what the customer's vision was for their future. They wanted to start by going from selling on price alone, meaning giving price discounts and concessions to their many call points, to instead focusing on larger customers, working the 80-20 rule and making sure that the customers that they were focusing on were truly the ones that were driving the majority of the revenue or revenue opportunities. Next, they wanted to go from having account-specific pricing based on relationships and other qualitative factors to having competitive pricing that was based on data and insights and customer segmentation. Pricing that was beneficial not just to the customer they were selling to, but for the medical device manufacturer as well. They wanted to have a win-win when it came to pricing and not have pricing be a game, but rather a cooperative partnership that was based on data. They also wanted to change behaviors by leveraging their total portfolio, which was considerably broad for the marketplace they were playing in. They wanted ways to consistently and productively cross-sell to customers based on purchase data and insights. And finally, they wanted to go from a standalone legacy e-commerce site that was not integrated with any other part of their business to an e-commerce site that was fully integrated with their SAP ERP system, that had up-to-date product and shipping information that was negotiated by each salesperson and would allow them to derive data and insights about their customers individually or in segmentations. Next, let's take a look at the legacy systems for product information and commerce for this life sciences manufacturer. Product information was often hard to come by in this environment. For example, let's take the case of launching a new product. In launching a new product, this medical device manufacturer would have product specs that their customers needed to have, pricing, negotiated shipping rates that were unique often by individual customer, as well as product pictures and other educational materials. While these different materials and pieces of information would be announced to the sales force at launch, as often happens, sometimes this information would be forgotten or end up in the back of somebody's email inbox. So when customers would try and find this information on their own, they would often turn to their sales team member. Sometimes the sales team member wouldn't have that information, and they would go to product marketing or go to customer service. Customers of this medical device manufacturer were not going to the legacy e-store because that legacy e-store didn't have any imagery on it. There was a standalone media resource library, but it was often referred to by customers as being a bit of a mess. New images were uploaded as they were available, and there wasn't much ability to organize imagery or spec information. So, in short, if you were a customer, you often spent a lot of time trying to find the right specs and the right images, and that created a lot of work for customer service, sales, and product marketing. The existing commerce legacy platform was standalone and was not fully integrated. Often, when customers would go to this website, it would have incorrect pricing or missing images and no ERP integration, and required manual IT involvement for any change, whether it was major or minor. As a result, the medical device manufacturer's customers would often not go to the legacy platform first because they would be often disappointed. Instead, they would go to their sales rep, who, if they didn't have the information, would go to their customer service rep or product marketing. A lot of time and therefore a lot of money was spent chasing down images or spec information, or even just the price for shipping or the price per unit of a new product. This created a lot of work. When this customer first started on its digital transformation process with SAP Hybris, there were some internal challenges as well as external challenges when it came to change management. Here are a few examples of what I mean. Both customer service and the sales force viewed a successful commerce implementation as a potential threat to their job. They were worried that they were going to be replaced by a website, either in whole or in part. In addition, customers were also slow to adopt technology, given that in the home care market, things had not necessarily changed in a long time, and some of the technology would not always keep up. Also, in this medical device manufacturer specific industry, it was common to have a significant number of SKUs. There were over 4,000 individual SKUs with continual updates and changes. So how did this medical device manufacturer solve some of these challenges with help from SAP Hybris? One of the first solutions was to address the issue of the sales reps and customer service reps being concerned that a commerce initiative would replace some of their jobs. Rather than replace their jobs, the new commerce site, or e-store as it was referred to internally, was positioned as a benefit to salespeople because it was not cannibalizing their quotas. The sales that went through the new e-store would become a part of that salesperson's quota. So if you were a sales rep for this medical device manufacturer and you had many call points in your area, rather than viewing the e-store as competition, you could send out a link to the e-store with some training and some collateral showing the customer how to use the e-store, and that customer could order themselves. And you could then focus on your bigger customers that were driving the majority of your number. Similarly, with customer service, the eStore was positioned as a tool for customer service. So, for example, every quarter there would be a survey of this medical device manufacturer that went out from customer service to customers, asking customers to rate the customer satisfaction of their purchases and interactions with that customer service group. The eStore was added to that questionnaire. So the customer service team was incentivized to receive good scores on customer perceptions about the new eStore. The new eStore was positioned to the customer service reps as a tool to help them be successful in their job and free up their time. In addition, customer service were some of the first voices in asking about what new improvements and additions should be made to the eStore, so that they felt that they not only had a tool to help benefit them, but also some say over how that tool functioned and what additional functionality that tool needed. Next, and perhaps most importantly, was the customer adoption issue. There were a few solutions. First, as you can see in number 3, the manufacturer was able to quickly target customers with relevant promos to drive adoption. So those promos were based on individual customers or groups of customers' purchasing history, so that any promotions that were sent to them were highly relevant and encouraged at least a trial. Next, because of the new SAP Hybris eStore's direct connection and integration with SAP ERP on the back end of this medical device manufacturer, customers consistently had accurate orders, pricing, and negotiated shipping rates, as you can see in number 4, which was a big improvement over the legacy system. In order to reinforce that message with customers, the medical device manufacturer, in working with SAP Hybris, was able to assemble talking points for sales that they were also using in collateral for customers to reinforce the message that you can access the new eStore 24/7 on your schedule with accurate pricing, with accurate orders, and you can look back at order history to make sure that you're getting what you need, and you can measure how much money you're spending with the company. So it was positioned as a tool and a convenience. And finally, and perhaps most importantly, the new eStore became a reference point for customers. Because the customers can consistently have accurate pricing, a full assortment of pictures, their negotiated shipping rates, as well as information about new products and marketing collateral, it became a destination. So now, instead of multiple locations, asking your sales rep or asking customer service or reaching out to product marketing, all of the relevant information about this medical device manufacturer's products, whether it's images, pricing, shipping rates, what replacement parts went with what SKUs, they were all in one location on the new SAP Hybris eStore, which was also integrated fully with the SAP ERP backend. So with all these improvements, what kinds of results did this customer see? First, they saw an increase of over 30% in the amount of revenue that they were transacting through this new eStore. This is important because the eStore was a low-cost channel through which customers could transact. It didn't require a salesperson or much interaction necessarily with a customer service rep. It was click, put it in your basket, and buy it. And because of that convenience, this new SAP Hybris eStore doubled the number of customers that were transacting with this medical device manufacturer through their eStore. So what did this result in for the customer in terms of benefits? Well, first, it freed up their sales force to focus on the customers that drove their number. They were able to actually live the 80-20 rule and focus on the 20% of customers that drove 80% of their revenue. The same could be said for the customer service reps. Customer service could concentrate on driving quality interactions and solving problems for the big customers that drove the majority of revenue. In terms of the benefits that the customers of this medical device manufacturer were seeing, there were several. First, those customers were being provided for the first time with insightful and data-driven promos that were geared to meet the needs of that individual or a group of home care providers based on data from their actual purchase histories. They were also consistently receiving up-to-date pricing, up-to-date shipping rates, and complete orders as a result of ordering on the new eStore. Customer pricing was also highly transparent on the new eStore. What you discussed with your sales rep was what showed up on the new e-store. In the past, with the legacy system, sometimes there have been errors, which could sometimes be read by customers as the medical device manufacturer trying to play games. But now the new e-store was very consistent and turned pricing from an ongoing negotiation or clerical exercise into something that was consistently and easily accessible. And last but not least, any updates to SKUs or new product launches were immediately made on the e-store. This was very important given that the medical device manufacturer and its industry launched multiple new products every year. So a lot of frustration was eliminated because of the e-store. So in closing, this case study shows how in life sciences, a commerce solution from SAP Hybris significantly helped a life sciences medical device manufacturer to withstand margin pressure and even grow revenue as a result of the commerce implementation with SAP Hybris. Thanks for listening. Again, this is John Burdett. I'm Industry Principal for Life Sciences and Healthcare. If you have any questions, my contact information is on the screen, and I welcome any questions you have. Thank you.